Hello, I'm Dr. Pasarilla. I'm one of the general surgeons at the Comprehensive Breast Center at MMC. When we find out that someone has breast cancer, as soon as we know, we will call our patients. Usually the doctor will, sometimes if the nurse will if we're overly busy, but as soon as we know, we're going to let you know. We don't want you to have to wait about this. We know that getting a biopsy is already anxious enough. Once you know you have cancer, the reality is it becomes an overwhelming fear that usually takes over. Part of our job as your physician at MMC is to walk with you through this process. It is certainly daunting. It is certainly at times feels like you don't have any control whatsoever, and our job is to try to help you give that control back by giving you the appropriate options and treatment recommendations. Usually in conjunction with our radiation and medical oncologic colleagues. Usually my treatment plan is I will actually have the patient come in a day or two after I've talked to them on the phone, and we will sit down and spend as much time as needed to go over what the diagnosis is and what the usual recommended treatment plans are. I think the more a woman knows and understands what her choices are, the more control you are able to get back when that happens. Certainly no one ever wants to have a diagnosis of any kind of cancer, but especially breast cancer. And it would be very easy to despair and give up. The amazing thing is that we have so many treatment options and modalities now that breast cancer is one of the ones that we're able to usually give a very good prognosis and outcome with when the diagnosis is made. So the first thing I tell my patients is not to give up hope, because it immediately feels like everything is falling apart. I do tell them that it will be hard, and I wish I could make them not have the problem in the first place, but knowing that you have it, we are still able to walk with you through it and expect that you usually will do well depending on the actual diagnosis. Thankfully, my family has not had to deal with breast cancer personally, but in my 13 years of practice here at MMC, I can truly say that the joy and the sorrow walking with multiple of my patients through this disease process encourages me to keep on continuing to help women as they come into our clinic with this diagnosis. I'm Dr. Pasarilla with the Comprehensive Breast Center, and your breast health is our mission.